Without further ado, it's a pleasure to introduce Dr. Vuyiseka Dubula, the head of Human Rights Gender Department at the Global Fund, for the first opening remark. Vu, over to you.
Thank you, Ed. Am I audible?
Yes, you are.
Okay. Thank you so much. Again, from this side, it's the afternoon, so I will use my clock to say good afternoon to everybody. But also welcome to this info session, which is meant to be looking at strengthening inclusion and operationalization of safety and security interventions in Global Fund key population programs. And this session is co-organized with ourselves as the Community Rights and Gender Department in the Global Fund and UNDP. And it's meant to help program implementers, program planners, particularly who are working with UNDP in country offices, in how we can look at how we are doing key population programming that are funded by the Global Fund with the intention of how do we strengthen the inclusion and how we operationalize safety and security. I'm Vuyiseka Dubula. As some of you have heard from Ed, I head the Community Rights and Gender Department in the Global Fund. I'm really excited to be giving these opening remarks and also I'll be introducing my old-time sister and feminist leader, Mandip, who's the director of the HIV and Health Group at UNDP. I'm sure some of you know that the Global Fund invests in many of the countries where you are working. And some of the work that we are doing, as you know, we are really working in countries that are facing multiple challenges that creates the environment within which we are implementing these programs really challenging, particularly around challenges around human rights, which we've seen a surge of anti-human rights and anti-gender laws, policies, and sentiments that really over and above many other challenging environments, for example, conflict, the impact of climate crisis. So all of these crises coming and hitting the same countries and the same communities at the very same time, making it very difficult for communities to access basic health services, and also limiting the impact that we can all collectively make to achieve our goals to end HIV, TB, and malaria by 2030. As you know, the Global Fund strategy centers communities. And for us, it's not just a tokenistic centering. It is in the DNA in how we do our work, particularly communities affected and infected by the 3 diseases, which are the focus of the Global Fund's mission and vision. So we seek to bring these programs, which we are going to be discussing with you today, in how do we come together to think about how do we remove human rights and gender related barriers that really become a challenge in how we scale up our work while we are integrating human rights and gender considerations through the life cycle of the grants and the Global Fund. And our work with UNDP dates back from, in fact, the second year of the inception of the Global Fund in 2003, where our partnership really has focused on supporting implementation of HIV, TB, and malaria grants in high risk and challenging contexts. And how do we also ensure that we can increase the capacity of national partners and to strengthen their own systems and how ministries and how they can also do their part in supporting implementation to achieve these goals that I've outlined before. But I want to also ask to take a moment that we actually have to remember that safety and security, it's not just within a context of challenging environment, but it's also in a context where key and vulnerable populations are not receiving services. And the Global HIV report is very clear, and it's telling, for example, that again and again, systematically, key populations are significantly left behind. And the word significant is a key word, because if you look by region, by program, key populations significantly are being left behind. And we see that we see it more if we compare, for example, East and Southern Africa and outside of Africa, the new infections that are occurring, the low ART coverage amongst marginalized and key populations who are facing significant stigmas, facing challenging laws, human rights environments are not conducive. Yet, we still today are facing quite a lot of services that they are not receiving, but at the same time challenged by the environment that does not enable people who deserve and need these services are not getting. So we are definitely going to be challenged in how do we use the safety and security programming to really close the gap so that we do not miss the deadline in 2030 and keep pushing another deadline 2050 and 2060. So the low ART coverage really sets us in a very bad way, high incidence rates, high mortality rates, and new infections that are also in the environment, even in Africa. I'm not saying that there are no new incidences in Africa, because obviously the limitations of the sexual reproductive health and rights services that are not offering or integrating prevention and treatment services for women is also creating another challenge. So just because we are seeing progress in some contexts, that doesn't mean there are no subpopulation level issues that we are facing and we need to highlight. And in this case, I'm also referring to the stagnation of progress of vertical transmission that affects particularly women and children, particularly children who are actually getting infected on a daily basis and not accessing HIV services. All of this is also driven by social cultural norms, religious beliefs that really have been driving sentiments and populist sentiments that have influenced and infiltrated laws and legislations in countries, policies that are really fundamentally violating basic fundamental rights of people, that have also been driving stigma, violence against women, criminalization, discriminatory policies that makes it really difficult for key and vulnerable populations and women in their diversity to access basic services. So this reality is not improving. It's becoming worse. In recent years, we've seen the widespread and systematic attacks on human rights, gender equality, sexual reproductive health and rights, attacks on democratic civic spaces. All of this affects the operations of the Global Fund and makes it very difficult. Even if we have money to invest, it makes it very difficult for that money to save lives. So all of these efforts are, if all of these efforts that we're making are really also shrinking or narrowing the space of communities and civil society to support and achieve our goals. So importantly, principal recipients, including UNDP, play a critical role in ensuring that key populations and our gender programming implementers and beneficiaries can provide and access services and continue to offer services in a secured way. Particularly in an environment where I've described, it's becoming more and more difficult, because on a daily basis, the implementation actions that we can take to reduce the risks, reduce the incidences, and respond issues as they come, but at the same time, ensuring that our role as sub-recipients and all other implementing partners, amongst many others who are involved in the delivery of care, including CLOs and CBOs, can continue to deliver services in a safe way and making sure that we do not lose lives at an implementation level, ensuring that people are accessing services while others can continue to intervene at a political level to reduce these risks and these barriers. So an early analysis of the funding requests that we've seen for GC7, for example, we've seen that more countries have started to prioritize integration of safety and security interventions in the programs in GC7. But we need to do more. And safety and security interventions are now should be included in KP programming, in gender programming sufficiently, but also a resource that it's not just a say that we must do safety and security, it must be adequately resourced. There must be resources that follows that commitment. And I don't want to take too much time. Now I'm going to invite my sister Mandip to share a bit of your opening remarks as well, whom I think you've joined already. I'm not sure. Can you check, Ed?
Yes, Mandip is on.
I'm online. That's great. Thanks, everybody. And thanks, Vu, for, I think, some really setting the scene so well for this important discussion on operationalizing safety and security interventions in Global Fund programs. And I think it's something in today's world that, for the reasons you've outlined, it becomes very, very important in HIV programs, in gender programs, and programs working on HIV. We see an extraordinary backlash against human rights, gender equality, and civic space. Harassment, violence, exclusion, pushing key populations who are already marginalized in their own ways further away from services. So we're at a critical juncture. Our partnership with the Global Fund, as you heard from Vu, dates back to 2003. We have been strategic partners as well as implementing partner of the Global Fund. And in the current times that we live in, it's more and more important that we join forces on these critical issues, such as scaling up safety and security interventions in the Global Fund's programs. It's more important than ever. We need the money to deliver more, to deliver better health outcomes and better human rights outcomes for key populations if we're going to get to the end of AIDS by 2030. We know of the data, Vu talked a little bit about it, sex workers, men who have sex with men, transgender people, people who inject drugs, and people in prisons are really disproportionately impacted by HIV. Outside sub-Saharan Africa, 80% of all new infections are in key populations. In sub-Saharan Africa, it is higher than it has been before. We don't have good data. And one of the reasons we don't have good data is because of the marginalization, vulnerability, and criminalization of these populations and the social and societal norms. But we have a terrific opportunity, even though the headwinds are strong. We have a political declaration on HIV and AIDS that includes some very important targets, some historic targets. And these are targets to remove gender-based violence, to end stigma and discrimination, and remove the punitive laws and criminalization, which is impeding access to services and really kind of fueling these human rights and gender-related barriers for key populations, people living with HIV and others. So we have a real opportunity with these targets, but we have to be smart. And being smart in today's world around key population programming means that we need to be strategic about safety and security interventions. What do these look like? You're going to hear from colleagues in Burundi and Pakistan today about how in Global Fund programs they have been able to address safety and security interventions and better address the needs of key populations. But I want to just talk a little bit more generally about what UNDP can bring to the table, where I think we need to go further as UNDP and as a good partner to the Global Fund. In terms of being able to do more on safety and security, where we're Global Fund principal recipient or otherwise. UNDP has a very, very strong governance mandate. We have strong relationships with duty bearers and rights holders in countries. We work with parliamentarians, judges, lawyers. So through our partnership with UNAIDS and even more broadly, through our health and development work, we have the capacity to bring to the table the governance mechanisms, organizations and capacities to help ensure the safety and security of people living with HIV, key populations, and other people affected by the three diseases. So I think UNDP, we're doing well in our Global Fund programming. We can do more. And we need to be more strategic about leveraging our governance mandate to be able to ensure safety and security of key populations. And I'll just give you one example of what I think that looks like in today's world. The UNDP-led SCALE initiative, which is a partnership with PEPFAR, Global Fund, some key UNAIDS co-sponsors working with key populations, is all about strengthening local leadership capacity, expanding the ecosystem of key populations at the local level to counter the discriminatory laws, policies, and criminalization that deny rights and undermine safety and security and drive people away from access to services. So I think that's something that we need to really, that kind of an intervention where we're investing in building the leadership and the ecosystem at the local level with organizations of people living with HIV and key populations is the broader kind of work that we can do together with the Global Fund to help improve safety and security within Global Fund finance program. So I'll give you an example. In Namibia, an LGBTIQ plus led organization strengthens community capacity through human rights training and the establishment of a safety and security committee. In Kyrgyzstan and Tajikistan, a joint dialogue with UNAIDS, Scale, and the Global Fund helped participants to explore strategic approaches and do scenario planning to be able to better respond to worsening human rights conditions. We've also published an important guidance on preventing and responding to HIV-related human rights crisis, which is all about safety and security in its essence. And that's an important tool that can help us strengthen the long-term safety of key and vulnerable populations. So one of the things that came up for me very strongly at the International AIDS Conference was that UNDP Global Fund partnership remains a powerful vehicle through which we can implement strategies like this, both through Global Fund finance programs where UNDP may be an implementer, but also more broadly through our other health work and through our broader governance work. So it's essential to recognize we ourselves may not be well placed to respond by ourselves in emergency situations. We must always work closely with NGOs, UN partners, and other partners to react rapidly, whether that's through financial support or support to get people to safety, or protecting human rights defenders, helping them move to get to safety. So there's a lot that we can do. I don't think anybody can address this alone. But the importance is the important thing to remember is to have strong partnerships and a partnership model where we can react quickly and respond and bring to bear both the resources of Global Fund grants, but also the broader resources of UNDP, the UN family, and the important work that NGOs and human rights defenders and key populations and people living with HIV do themselves in this space. So I'm delighted that to be opening this webinar with my sister Vu, and who's always a great source of inspiration. And over to you now. I'm looking forward to hearing from all of you. Thank you.
Thank you, Mandeep. That was really full of powerful examples of how your work has really been shifting but also capacitating and supporting and strengthening what's happening on the ground. So maybe just to share a bit about what the agenda is for the day, and then I'll keep quiet because it's not all about me and Mandeep, it's all about the work that is happening in country and how we are working together. So the first, the agenda is structured in three parts. The first session will be looking at typologies of safety and security interventions and what can be and should be included in what we call key population safety and security programming. And the second part will give us a much more nuanced, but also experiences in how you can operationalize a safety and security related intervention using a reflection from Pakistan and Burundi, which Mandeep has referred to in her opening. And how has it worked in Burundi and Pakistan? What are some of the lessons and examples and case studies we can pull through from that example? And then the third part will be an open, moderated question and answer, which will be moderated by Ed, whom you saw at the beginning of the session. Now, without wasting too much time, I'm going to hand over to my colleague Matteo, our KP advisor at CRG department, who will take us through the first session in taking us through the types of safety and security interventions that can be included or not, and how it can be budgeted. Over to you, Matteo.
Thank you very much, Vu. And so my job here is to basically for the next 15 minutes to take you through what are the type of security and emergency interventions that we should be thinking about including in our key populations programs, and also a couple of tips on how to go about budgeting and paying for these costs. If we go to the next slide, I just want to show you here how human rights programs and security interventions are intrinsically linked. And I'm using this tree that you see here to explain a bit how this works. Now, if you look at the level of the leaves and of the branches, you will see examples of violence that all too often take place in key populations programs, stuff like blackmail, stuff like theft, arrest, detentions, gossip, are all examples of security incidents that might be affecting your key populations programs. Now, security and emergency interventions typically address these type of incidents, right? Now, if we look at what happens below ground at the level of the roots, you'll see stuff like, ignorance, anger, fear, stigma, discrimination, criminalization, religious, cultural beliefs, and even harmful gender norms. These are the type uh, of issues that we try to address via that also we try to address via human rights programming. But this is not to say that that security interventions and human rights programming are separate. They are not. If you go to the next slide, you will see, for instance, that many human rights interventions are effectively foundation and part of security interventions and key populations programs. For instance, look at having lawyers on retainers, being able to cover costs related to tribunals or courts, being able to have a human rights violation and monitoring response systems in place, or even being able to have paralegals or peer educators trained in access to justice and being able to advise and inform beneficiaries on what are their options in case of a security incident, right? So just to say that, these two elements, security interventions and key population and human rights programming are really very much interlinked. Now, if we go to the next slide, we'll have a look a bit at what are some of the tips that we can give, that we normally give to KP organizations to beef up security, if you like. But before going into these ones, I would like to just say that and remember that the challenges, the security challenges that might be affecting a key populations program, not necessarily in any given country, not necessarily are the same ones that are affecting another program. So just let's be reminded that it is really highly contextual when we talk about security. So it's important for each organization to being able and to be empowered in identifying their own security threats and security risks, to being able then to come up with the right set of interventions that will make their program more secure. Now, this said, so understanding that it is contextual, as Global Fund, we have noticed that it's actually useful and helpful to provide some pointers to organizations, to things that they can think about, right, when needing to increase security in their key populations program. And here you see 6 different tips. The first one is making security a routine thing, which basically means ensuring that you are prepared as an organization to mitigate and address security incidents if they do so happen. What does this mean? This might mean, for instance, things like having a security framework in place, or it might mean having standard operating procedures for specific part of your key populations program that might require a specific attention to security when you implement it. One above all could be your outreach program, right? Which is one of the places where more often we see security incidents taking place. It could also though mean small things like ensuring that your staff always has an ID card, or ensuring that you keep a visitor's logbook in all your project locations, meaning a drop-in center or your offices, right? This is really highly contextual, but just to say that it's really important to make it a priority as an organization, right? If we are to increasing it, security, I mean. As a second step, it's really important to have a way to record and discuss regularly security incidents as they take place. Why is this important? Well, not only to keep track, right, of your incidents, but also because if you keep an incident log, that might help you identify particular trends or patterns in the way security incidents take place. For instance, if we go back to our outreach program, if we see that at any given hotspot, incidents are increasing, then that's a good, a good information, because it might tell me, all right, maybe I should either halt activities at that particular hotspot, or maybe I want to increase my security interventions at that particular hotspot. Third tip is really around ensuring that the organization identifies and assigns a security focal point among its staff, and that staff is regularly trained on security. Why is this important? Because first of all, if we have a person to go to in case of insecurities taking place, then we can also be more coordinated in our response. Also, training staff on security helps them being more careful about avoiding harmful ways of doing things, and also, again, knowing how to respond quickly in case something does happen. Fourth step, and you see it there, is about managing private and public information about the key populations programs, about the stuff that works in the key populations program, so that people that might have the wrong intention don't get to know, for instance, where your project is being implemented, the locations where you do outreach, or also avoiding that that for instance inadvertently uses social media to post pictures about some particular services that are being offered, or some particular places where services are being offered. Fifth step is about cultivating allies, ensuring that organizations and the KP program does not operate as an island, but really operates in connection with all the other organizations that are implementing in the same context, the same program, but also ensuring that, for instance, there are particular organizations. At times, these can be UN agencies. At times, these can be ministries of health, that the organization keeps those relationships and cultivate those allyships, because they can be very, very helpful in case we find ourselves in a situation of crisis. And now coming to the last point, and this is one that I think is one of the most important ones, obviously, is ensuring that the organization has and develops a rapid response plan, because this helps ensuring that the organization knows what to do, right, as a whole when things happen. It means that we have developed, for instance, a phone tree, a ways of managing communications during a crisis, that we know who needs to know what and who needs to do what. And also importantly, maybe it involves, if possible, setting aside an emergency response fund. And if we go to the next slide, I would like to tell you a little bit more about the emergency fund, because then this is also a very important element of it. So what might be included in an emergency fund? Well, things like emergency accommodation, emergency transport, healthcare, including mental health support, very, very important, both for staff and beneficiaries, nutritional support, or legal assistance and legal fees, as we saw earlier, for instance. So all these costs are really, really important, all these services. But it's critical that if we are to set up an emergency fund, we are not just thinking about setting money aside, but it's important that we accompany this money set aside with a clear mechanism, clear governance mechanisms that explain how this fund can be used, right? Can be accessed. So there need to be, for instance, clarity on eligibility of services. What can we pay for it? What can we not pay with it? Who has access to it and when? And also establish thresholds for access, cost thresholds for accessing a particular service, which may mean, in case of emergency accommodation, that you can't expect to obtain an emergency accommodation for a year, but maybe the fund will only cover the first week or the first 3 months of need for a particular beneficiary. So it's important, that the emergency fund comes with this type of criteria clearly described, because it will, at least for global fund purposes, it would be very important for it to be approved, right? But I'll be telling you a little bit more about that when we come to the budgeting section. Now, if we go to the next slide, we're actually entering a bit the part that is more about how do we effectively budget for these interventions in global fund grants. And this is a bit specific, right, to our global fund processes and procedures. Now, the first step, obviously, is to decide how you want to integrate security and emergency activities in your key operations programs. This will be definitely dictated by where you find yourself in the grant life cycle. And depending on where you are, there are normally two options you can pick. One is to go for the upfront inclusion of security interventions in the funding request when it's being developed, or maybe during the grant making stage. And the other option, which is a bit less recommendable, is to do a grant revisions, which happen. In this particular case, we're talking about programmatic and or budget revisions. But before we go and dive a little bit deeper into these two options, I just wanted to remind ourselves that not all security interventions require funding. So it's always important to have a discussion, beforehand on, okay, what type of interventions do we need? Do I need to make budget room for this particular intervention? Can I not accommodate this intervention within an existing given, for instance, if we're talking about providing training, security training to your staff or to your peer educators? Well, if you are already planning a peer educator training, well, maybe think about adding a module, adding a day or two to your existing training to accommodate for security in this particular case. So I guess also always try to remember that it's not always about money in this case. But yeah, if we go to the next slide, you'll see, basically what I was talking about. This is about the upfront inclusion of security interventions in grants. It's by far most recommendable way to include security interventions in grants, in global fund grants. Why? Because it's the simplest and most straightforward approach. Always remember that adding new activities to an already approved budget, so adding a budget line to an existing approved budget, it's a serious task and needs to happen via some type of grant revision. And depending on how much money and the significance of the investment you want to make in security, approval process can be long, can take quite some time. So it's important to always think that if I can at least try to include a security budget line at the start of the program in the budget, even maybe allocating an amount of money that is not significant is a good idea. Why? Because it's much easier to go back to this budget line later and maybe reallocate some more money via grant savings rather than creating a new budget line that was not there before. Right? So I hope I've given you a bit the idea of why it is important to try and include everything from the beginning. Now, if we don't manage to do that, then we go to the next slide. We'll see that what is needed is a grant revision. Now, there are various types of grant revision of the Global Fund, but here we're only going to be focusing on two types, the programmatic revision and the budget revision. If you go to the next slide quickly, I'll show you what these are. So programmatic revisions are those revisions where we're basically adding an intervention or a module to our budget. Basically, we're asking to do an activity that wasn't originally included in the budget. Now, depending on what type of activity we want to include, the programmatic revision might take more or less time. It might become more or less complex. So the easy way is if this activity, this intervention we want to add is already part of the unfunded quality demand, a list of activities that we have prepared together with our grants, then it's quite easy and straightforward to bring that activity from the UQD register into the grant, right? This type of process will not likely require a TRP review of the changes you are trying to make. It is a different question though if the activity you want to include is not part of the UQD register. This will mean very likely that the TRP will have to review. And I mean, it's not to say that the TRP review is a complicated thing. Only it takes time. So it's important to always think about what ends up going in the UQD at the time you are negotiating for your security interventions during the grant making stage, for instance, right? Now, programmatic revisions, if you go to the next slide, as I said, might require or might not require TRP review, but both systems will require CCM endorsement and obviously an approval from the Global Fund. The approval authority will change depending on the changes that you're trying to make to your programs, how many modules, how many interventions you're adding, and obviously what is the value of this investment that you're trying to include. But yeah, there is an amount of time that is involved with this type of process. So normally it can go from a minimum of a couple of months to 3 months total, I believe. Now, if we go to the next slide, we'll be looking instead at the budget revisions. Now, budget revisions are simpler type of grant revisions in the sense that they do not involve adding or creating new modules or new interventions or cost categories in the existing budgets. They involve simply moving and shifting amounts of money between activities that are already included in the budget, right? Now, depending on how much money you're moving between these modules, between these interventions or cost categories, then the budget revision will be categorized as material or non-material. If you go to the next slide, I just wanted to show you that obviously there are thresholds that dictate if the budget revision is material or immaterial. And the big difference between the two types is that the non-material one does not require Global Fund approval and does not require CCM endorsement, right? It's something that the principal recipient, in our case, UNDP PMUs, can do on their own without necessarily informing the Global Fund. It's good practice, right? But it's not needed to have an approval. What is required from the PR is to keep track of these changes. Obviously, as long as they remain within these thresholds that exist for the intervention level and for the discretionary cost category level. Now, I'm not going to go into the details of this, but just to say that because our interventions at times are massive, and also the amount of money included in any discretionary cost category can be a lot. Even moving money between these budget lines at times is something that can be do quite quickly, because the amount of money is so big that even that it's easy to stay below the threshold. Now, when it comes to a material budget revision, meaning any changes that go above the thresholds, this will require informing the Global Fund, the approval from the country team, but also will not require, even in this case, a CCM endorsement. So again, the process is, at least at country level, a little bit more straightforward than a programmatic revision. Now, just two slides to close. If you go to the next slide, I just wanted to show you that obviously all your security interventions need to be eligible, and the costs need to be eligible. There is a whole diagram to follow to understand if a cost is eligible or not. But basically, if the cost, intervention, or activity can directly or indirectly be attributed to the goal of the Global Fund, then it is normally eligible cost. Here also wanted to go back again to the fact that security emergency intervention, like having an emergency fund, for instance, in the budget, is possible, and it has happened. It does happen. Important, though, is obviously to have, and as I was saying earlier, transparent criteria and conditions for the allocation, right? And if we go to this last slide, I just want to show you where we can include in the modular framework security and emergency activities. Well, there are three main places where you can do that. One is in the KP prevention modules, under interventions removing human rights related barriers. If not in the human rights module, and you have a range of different interventions where you can include it, but principally eliminating stigma and discrimination, legal literacy, and increasing access to justice. And if not, you can also pick the community system strengthening module. And again, they are probably the capacity building and leadership development interventions, and the community-led monitoring interventions are the two most obvious one where you can do that. And now I'll stop here. I'll thank you, and I'll hand it back to Ed. Thank you.
Great. Thank you so much, Matteo, for providing us a very helpful, useful tips and walking us through the details of how to ensure we include security and emergency interventions in the Global Fund supported program. We will now dive into two specific country examples to learn from the experiences of UNDP in promoting safety and security of key populations. Starting with Burundi, let me introduce George Biosk, who is the program specialist, human rights and key population at UNDP. So George, you have the floor.
Merci pour la parole. Bonsoir.
Thank you very much. Good afternoon and good evening, dear colleagues. So this study that I'm going to share with you on Burundi is mainly a case that we had in 2023. But before starting with my presentation, I would like to present or to mention the context.
Slide suivant. Okay.
So this is the background in Burundi. It's quite a complex background because in Burundi, three populations are considered highly exposed to infections, to STIs, to HIV, including the viral hepatitis. These three categories are men who have sex with men, sex workers, and drug users, including injectable drugs. In Burundi, even using the term key populations is not officially authorized because they want us to talk about populations who are the most exposed to HIV. In general, the trend of the epidemic is downward, even if the prevalence has increased, as you can see here. So it's, as you see here, but this prevalence is also hiding some trends regarding the key populations amongst sex workers. In 2013 and in 2021, we had two studies showed that the prevalence amongst sea workers was of 21.3% in 2013, and in 2021 this prevalence was 30.9%. Now in MSM population in 2013 the prevalence was 4.6% and it went up to 5.96% in 2021. Now amongst the drug users, including injectable drugs, the prevalence in 2017 was 10.2 and it was 15.3 in 2021. You can see that there is a big difference between these prevalences regarding the general population and the key populations. So we see that these epidemics are more concentrated around the key populations. Now, what's the legal environment in Burundi? Well, the lack of distinction between consensual and non-consensual acts between two people exposes most of the population to violence and to prosecution. Since 2009, the Burundian Penal Code, in its Article 567, has condemned relations between persons of the same sex. And this can go from 3 months to 2 years of imprisonment, and also a fine ranging from 50,000 to 100,000 Burundian francs, which is between 24 and 48 Swiss francs. So, in our penal code, articles 564 and 565, respectively, condemn or mention the concept of good morals. But what does this mean? And it also mentions the behaviors that offend modesty. So once again, one can ask, what does this mean? What good morals are and what behaviors that offend modesty are? So you can see that the context is quite rigid regarding the key populations in Burundi. Now, what really happened in February 2023 in Burundi? Well, on February 22, 2023, in Gitega, the political capital of the country, the key population was meeting around a training workshop, and during this workshop, 24 people were arrested because they were accused of homosexuality, according to the Article 590 of the Penal Code. And several of these people were also charged with incitement to debauchery, according to Article 562 of our Penal Code. And during the process, two other people were accused. So there were 26 people, and they were actually condemned even in their absence. And then on August 21st, 19 of these people were acquitted and freed, but two of the 7 people who were found guilty in their absence. So then, in January 2024, both the prosecution and the defense appealed the court's decision, and so the Court of Appeal found all 26 defendants not guilty of the charge of homosexuality, but 5 people were convicted of incitement to debauchery and sentenced to 1 year in prison and a fine. So, how come these people were freed up? Because I mentioned they were released. Well, that was thanks to many things that led to their release on the 24th of January. we had this legal assistance. The UNDP Burundi Bureau was informed of the situation by members of our local organizations, and there contracted with a law firm with the approval of the Global Fund. So they hired a specialized law firm to handle the case. So this law firm representing these people really pleaded for the release of these 24 people. So they were released thanks to that. But we had this legal assistance, but not just that. You know that these key populations are very vulnerable populations. Some of them were arrested while they were sick. So while they were in prison, the community associations gathered to offer humanitarian assistance to these affected people. So they help them in terms of health support, and also they offered assistance in terms of food for the affected people and for their families, because some of the members of the community that were arrested, they lived in their families, and while they were arrested, their families also suffered a lot of pressure, not just from the police, but also from some of the other members of the community. But thanks to these associations, they could benefit from a psychological support while their children and family members were in prison. Also, next to this legal assistance, this humanitarian assistance, we also had what I call self-diplomacy. Some embassies and diplomatic missions present in Burundi, such as the US Embassy, the French, Belgian Embassy, and also the EU delegation, really advocated for the release of these people. So they played a very important role so that these people were released, because there was one person who died in prison before being released. So they advocated for the respect for human rights. So even that person died, even if the community associations brought some medicines to prison, but that was not possible for him to survive. So this self-diplomacy played a very important role, and this diplomacy also contributed to the release of these people. Of course, we should not forget the lobbying led by community actors. There was a very strong lobby that was led by these associations, and I'm referring to national associations and also regional associations. They led an intense lobbying campaign to draw attention to this case, this violation of human rights in Burundi. So they used the media, international organizations, and this also allowed to exert a very strong pressure on the Burundian government to release these people. Now, which are the lessons that we have learned from what happened in Burundi last year? Well, I would like to say also that these charged people who later were released in January 24, in September, last September, 5 out of these people were again arrested by police in Gitenga again, because when the first release happened, many members of this group left this capital city to go to other places, but some of them stayed because they still had activities and jobs. But some quitted their jobs to go somewhere else. But in this last month of September, some of these people were arrested once again, and the UNDP did the same things, and also with the same law firm again worked, and these people were again released beginning October this year. But the release of these people who were arrested in September allowed us to understand that these people are still controlled and followed up. So they finally were transferred to another place. And with this transfer to Bujumbura, since actions are organized in a concerted manner with other partners, with the UNDP and other actors, well, the legal support continued, and so other organizations took the activities that they were conducting, so the services continued to be delivered. So as of now, the support to these people that was offered by the regional organization is still going on, but the advocacy continues. Of course, the assistance has to go on so that these people can continue to work and to make money because they had their job in the capital city. So now they completely changed their lives, and so that was just something that I wanted to say for you to see that this problem continued, because once again the context in Burundi is quite complex. Now, which are the important factors that we need to consider? Well, we need to take into account that the socio-political context of Burundi is really influenced by the anti-gender and anti-rights movements in Africa. As you know, with the anti-gay people law that was adopted in Burundi, well, this had a huge impact, and other states also strengthened their laws anti-key populations. Okay, so this makes that these populations, this forces this population to live in very vulnerable situations. Which are the preventive actions that we can envisage to mitigate this? Well, we need to invest in local monitoring and response mechanisms by community associations, because community associations do understand and know the social context and the cultural context, and they are better placed to respond to these issues. So it is very important to invest in monitoring and response mechanisms by community associations, and we also should provide local associations with multi-year and flexible funding to respond to emerging cases, as we have seen recently with this second arrests of these people. If NGOs, if international NGOs do not intervene, because local NGOs do not have enough funding, so they can't support these people because they don't have enough resources. So it is very important to provide these local associations with flexible fundings and multi-year funding so that they are able to plan their activities to mitigate these situations.
George,
At the same time,
my apologies to interrupt, but we are way behind. But really appreciate you sharing these practical examples of how the Burundi case has responded to this crisis, and appreciate your support in this situation, as well as acknowledge presence of Anne-Sophie Dupret, who is part of the country team working really closely with you in the case of Burundi from the Global Fund side. With that, may I hand it over to colleagues in Pakistan, Dr. Umar, to briefly discuss the Pakistan's case lessons learned. And if Josh, Umar, if you could be brief, that would be really appreciated because we do have a number of interesting questions that we want to touch upon towards the end of this webinar. Thank you very much. And sorry again, George, for cutting you short.
Sure. So thank you very much. And good morning, good afternoon, and good evening to everyone joining. So I'll just start with the background. UNDP became PR in 2021 from 1st July. And since then, it's more than 3 years that we have been implementing the prevention and the treatment component of the Global Fund HIV grant. As far as the prevalence of HIV is concerned, Pakistan still has a concentrated epidemic. And on the screen, you see the figures from the last IBBS, which happened in 2016 and 17. And you can see that the highest prevalence was recorded among people who inject drugs, 38.4%, followed by the transgender sex workers, 7.5%. The all transgenders prevalence was 7.1%. Then we had the male sex workers with 5.6% and MSM 3.5%, and finally the female sex workers 2.2%. So just to update you that since that IBBS, now UNDP has conducted the 6th round of IBBS, which is completed, and the data analysis is going on. And the results will be available by the end of this month or early next month. Next slide, please. So in Pakistan, the HIV epidemic, as I said, it is concentrated among the key populations, which are one of the most marginalized and the stigmatized sections of the society. In fact, they live at the fringes of the society. They are not accepted anywhere. There are problems of poverty, illiteracy. A lot of them are undocumented because they don't have papers. They are street-based, and they face a lot of problems. UNDP commissioned the second stigma index study in Pakistan, which was conducted by the Association of People Living with HIV. And the results show that there is stigma and discrimination not only in the healthcare settings, but also at the level of the right providers with they interact. And the major significant issue that was identified was the unconsented disclosure of the HIV status to the families, to the community, and the society, and which causes a lot of negativity for the people. And the stigma index also showed that there is a lack of an enabling legal environment, and there is a weak justice system for the people who belong to the key populations and also from the community of people living with HIV. Next slide, please. So we are going to present 3 interventions that we think that they are related to security and safety of the key populations. So the first one was that UNDP commissioned the development of law enforcement agencies engagement strategy under the Global Fund grant for the very first time in Pakistan. As I said, that the key populations are marginalized and criminalized, so they have a lot of contact with the law enforcement agencies, especially the police. And the police and the law enforcement agencies, they are not really trained about the health issues, especially about HIV. They have no knowledge about the modes of transmission, and there is a lot of stigma and discrimination. So we engaged a very reputed consultant who had previously worked as the Inspector General of the police in many of the provinces, and he also has a doctorate in rights and about criminology. So he engaged the law enforcement agencies, UNAIDS, government, other UN agencies, civil society organizations in all the provinces, and a comprehensive strategy document was developed, and it has been submitted to the Ministry of the National Health Services and Regulation for endorsement. And as soon as it is endorsed, we will support the government to share it and launch it with all the law enforcement agencies in all the provinces and districts of Pakistan. Next, please. So the second intervention that we thought we can share with you is our Access to Justice initiative and the community-led monitoring. So UNDP has introduced the Access to Justice initiative to reduce the inequalities and mitigate the prevailing HIV-associated stigma and discrimination. So what we did, we contracted, I mean, we advertised at TORs, and then we had a transparent process, and then we onboarded a firm which then established 10 legal aid desks and onboarded 10 legal experts from the mainstream court and justice system. And they carry out community outreach directly through the community-based organizations working as partners with UNDP in the Global Fund grant. And I would like to add here that since UNDP became PR, we expanded the HIV prevention program for the three key populations, namely MSM, TGs, and FSW, from 19 service delivery points to 53 service delivery points all over Pakistan. And in 2021, there were 20,000 people from key populations who were accessing HIV prevention services, which are now over 100,000 per quarter. We clubbed those services with these legal experts so that people can also seek legal counseling, case management, referral, and awareness raising about human rights issues. And mostly what we have seen is that people from key populations, they consult these services for inheritance, especially among the transgenders, and also to seek advice for domestic violence and other issues related to their life. Next, please. The third intervention, there are basically two parts of this intervention. As I said, that we are working with the community-based organizations for the three key populations, and mostly the staff, the field workers, they work on outreach basis, and we try to get them from the communities. But as these are criminalized communities, they face a lot of problems while going on streets in the hotspots and communities. So what we did, we advocated for the provincial governments, health departments, and the AIDS control programs to issue authority letters to these field workers so that they have these letters with them. So if there is any interaction with the law enforcement agencies, they show these letters as evidence that they are registered organizations contracted by UNDP and working in collaboration and with the authority of the government under the Pakistan AIDS strategy. So this gives them a sense of protection while going into the field and working for the key populations. The second thing we did was that as 90% of our work is outreach based, and the outreach workers, they either move on motorbikes or the MSMs and some of the TGs. But for the female sex workers and a lot of other transgenders, they have to use public transport or they have to use rented vehicles because they had huge mobility problems. So we, in the reprogramming, we requested Global Fund for the provision of mobile vans to have better outreach so that more staff can move at the same time to reach more distances and to reach and to also have, provide counseling or testing services inside the vans if there is no place available where it can be done confidentially. So we have procured these vans. These vans have reached Pakistan. Their registration is almost at the final steps, and we plan to distribute them hopefully around the World AIDS Day or during the first or second week of December. And the key population CBOs are eagerly waiting to have these vans to increase, to enhance, improve their outreach services. Next, please. So the key lessons learned, there is one lesson which is not mentioned here. When we started off with this grant, we did not have a staff in the UNDP PMU team to specially look after the stigma, discrimination, and the issues related to safety and security of the key populations and all that. So we requested Global Fund to create a new position of Program Officer Stigma and Discrimination, who now looks after all these issues related to gender, related to legal assistance and stigma and all that. And she has helped a lot in designing our interventions and making sure that they are according to the policies and procedures and as per the aspirations of the key population. So the main lessons of 3 years are that the current environment on HIV legislation is still not advanced. There is only one province which has an HIV Act, a legal act which was passed in Sindh province by the Provincial Legislative Assembly to have rights for the people living with HIV. But other provinces, they still have to do a lot of work. The political will from stakeholders, especially the policymakers, remains a challenge. We have been engaging them for last 3 years, but still a lot needs to be done. There is still a high level of stigma and discrimination towards the key populations and HIV community, although this stigma index showed that there is a little bit reduction in stigma as compared to the last stigma index, which was conducted more than 10 years ago, but still a lot of work needs to be done. And finally, we had this challenge of political instability because there was a huge, very long transition of the government from the previous government and the elections and the new government. So these are some of the lessons which we'll be looking after in the next grant. So thank you very much. I think I respected the 10 minutes time. Thank you.
Very well respected, and thank you so much, Dr. Umar, for being super concise in the presentation and sharing the case of Pakistan. We will now move into the Q&A section. Yes, and we do have a couple of questions here that we want to go through. And my apologies for slightly behind the schedule. If you could stay for a couple of minutes more, we would really appreciate it. So the first questions from Fabian is related to the digital security. It would be great to hear what speakers think about the opportunities and risk of increased use of digital tools for safety and security of key populations, including in human rights and other crises. I'm wondering, Matteo, would you like to just kick off and attempt to respond to this question and then see if other panelists want to share as well? Over to you, Matteo.
Yeah, sure. Thank you for the question. No, I mean, there's definitely a lot of risks and opportunities linked to the use of digital tools. In terms of opportunities, we'll think about everything that has been achieved when we do online outreach, for instance, right? And it's quite a way to do demand for prevention in a very safe way, for instance, without exposing our staff to unnecessary security incidents. But there's the opportunities that technology gives us are pretty much infinite when it comes to our work, right? Think, for instance, that the fact that you can always know where your staff is, using tracking devices, which makes it secure for them. Think about how you can safely storage your data elsewhere, not even in a country where maybe the data you're collecting might be identifying criminalized populations. Think about all the offers, all the opportunities that are given by digital devices that can be password protected, two-step verification, encryption, even the fact that you can have mobile device management tools they wipe out all the data from an asset the moment that maybe it's lost or it's stolen. So there are a number of important opportunities that I think we can always leverage when we talk about security. Obviously, right? Because there's always it's like a double-edged sword, right? So then if you think about a cell phone now that can contain so much data, and that is normally used for data collection at outreach sites, if that were to fall into the wrong hands, then it wouldn't just be like one piece of paper with some data. It would be probably the data of the entire program, for instance, and that can become obviously a challenge. So it's really important that we pay attention to that, and we do. Our training, in our security training, includes a specific modules around digital security, and there are a number of partners that specialize regionally on providing this type of support. And I'll stop here. Thank you.
Excellent. Thank you, Matteo. Any short, quick thought from Dr. Umar or George on the digital security?
Yeah, as far as digital security is concerned, in Pakistan, we have a web-based MIS in which the prevention data and the treatment data, both the data goes into that MIS. And that is hosted by the government, and it is secure. And all the people who are registered in the MIS, they are issued a unique identifier number, which we call the client registration number. So that number is there on the front, which is used as to identify those clients. And in the last 3 years, we haven't had any problem or issues related to digital security of these people. Thank you.
Great. Thank you so much, Dr. Umar. So the second question from Juan Carlos, I believe, has been responded to. It's in relation to the resources for transportation, which George has alluded to in her presentation on Burundi. The third question from Maureen from the Global Fund: how does UNDP ensure that all UNDP implementers are aware of this approach? Should the Global Fund assume that UNDP has trained all UNDP PRs on these issues to enable this approach is implemented at the country level implementation, or at least introduced at the country level? I'm wondering if Mark, would you be able to respond to these questions, Mark from UNDP, or if any of the UNDP colleagues in Pakistan or Burundi want to respond to? Over to you.
Yeah, thank you, Ed. So I'll try to answer, and then if any other colleagues want to come in. No, it's a great question, Maureen. So I think from our side, there's a few ways that we make sure that we're sharing the guidance from the Global Fund as well as opportunities for knowledge exchange. So we have the Health Implementation Manual, which has the guidance. We have a Capacity Development Toolkit where we also share it. And we have a Community of Practice, which provides good opportunities to distill that. We also have people on our team at the global and regional level with expertise in this area. But I think certainly that there's opportunity to make sure at country level that we're looking at what are the good practices happening in terms of engagement with the UN country team. As Mandeep said at the beginning, really looking at what the partnership approach can bring to the strategy. Often, I think the planning is something that needs to be really underscored, that colleagues in country are aware not only of what they can do in terms of the flexibilities with Global Fund funding, but they've looked carefully through, the who, what, where, when, and the how, and that there's sufficient planning to the extent that we can integrate that into Global Fund grants. So there are a number of resources and strategies that we have to make sure that teams in country are aware of what the guidance is. I'll leave it there if anyone else wants to add.
Great. Thank you so much, Mark. I think you have responded to the questions very well. The fourth question is from Rocio. Do we have example of standard operating procedures for emergency fund use? Perhaps, Matteo, you have some ideas on this question?
Yeah, sure. I'm happy to come in here. No, we do, right? So part of the work that we support that we provide as CRG, but also as Global Fund to our implementing partners, is also one around developing security frameworks and identifying those particular areas of programs that require standing operating procedures around security. So yeah, we do have some examples. Obviously, these are quite contextual, so it will support the organizations developing their own SOPs. So we can't share them as an example, but obviously, it's not that it can just be taken and, applied elsewhere. It will need some level of adapt. Thank you.
Excellent. Thank you, Matteo. And last question from the audience, from Patricia. Did the UN Joint Team on AIDS play a role in this intervention? I believe the question was asked when George presented. So George, would you like to speak to this question? In the case of Burundi, has the UN Joint Team been part of that response that you developed and delivered? Thanks.
Je dirais, au cours du PNUD, oui, l'ONU.
I would say that UNAIDS, yes, was present in this follow-up process. But taking into account our context, the joint team did not have the main role. The main role was played by the lawyers that were in charge of the case, and also the diplomatic missions that were intervening, that were negotiating. Okay, but yes, they were also there, and they supported the UNDP in this process. Thank you.
Excellent. Thank you so much, George. So that is it for all the questions we received today. I'm sure you have more. Please make sure that we continue these discussions. And that is it for now for the Q&A sessions. Oh, there are two more. Perhaps we could do it very quickly. The question from Leah, were the measures in place in case of arrest in NFM3? I believe that's a question back to you again, George, on Burundi.
Okay, merci.
Yes, thank you. In the framework of the NFM3, we did not have, as now in the GC7, clear activities around the support for populations around human rights, because back then we didn't have no one responsible of the human rights issues. So what happened actually resulted in the creation of this job, this title, this head of human rights issues, but back then we did not have that.
Excellent. Thank you so much. And the last two questions from Alice and Boyan. I believe the speaker and presenter have responded in writing. In the interest of time, my apologies. I think we would not be able to discuss them now. Again, I have to bring this webinar to a close, but before I do so, I'd like to share a few highlights. First, everywhere, particularly in the countries where we support, with widespread systemic attacks on human rights, gender inequality, sexual reproductive health and rights in civil society spaces, our partnership with UNDP is so crucial. And as part of the duty of care, both institutions, the Global Fund and UNDP, have a responsibility and obligation to ensure that programs that we fund, support, do no harm for both frontline implementers and beneficiaries, as mentioned by Vu from the Global Fund. And this means, in particular, embedding security consideration into the HIV services for stigmatized and criminalized populations. This is not just an add-on optional things to do, but an essential part of the program everywhere. And with the UNDP playing a critical role in terms of managing the Global Fund grants, and as key UN agencies promoting protecting human rights for those we serve, we have the opportunity to do more on security. And doing more, for example, what mentioned by Mandeep is about leveraging UNDP governance mandate as well, of engaging law enforcement agency, Ministry of Justice, judiciaries, and other stakeholders while supporting community leadership. Second, based on our collective experiences, a range of actions ranging from making security a routine part of your program as a principal recipient to developing crisis response plan and building allies could contribute to making the program safer. And when crisis hit the key population program implementers and beneficiaries, whether it is funded by the Global Fund or other donors, we do have an opportunity to respond, either, for example, through upfront inclusion of security interventions or program or budget revisions to deploy funds for emergency responses. And third, we had seen and would like to commend UNDP for its remarkable efforts in integrating security consideration in program delivery and responding to human rights crisis. The case of Burundi, for instance, has demonstrated clearly that legal assistance, temporary support for families, soft diplomacy, and along with support for continuing community-led advocacy and lobbying are so important in crisis response. And as with the case for Pakistan, negotiated authority protection for SR and SSRs, access to justice program, and integration of legal literacy and know your rights really contributed largely to the success of HIV prevention outreach program, even in the very challenging human rights context. So with that, I'd like to take this opportunity to thank all of you for your active participation, especially thank all the speakers for their insightful presentation, and sincere appreciation to Mark, Angela and Luciana at UNDP, Matteo at the Global Fund, and our communications team for putting this webinar together.